This is Action News Jax special coverage, Coronavirus Pandemic.
And good evening, I'm John Bachman.
I'm Tanika Hughes. From its emergence in late December in China to tonight, the coronavirus has killed thousands, disrupted global economies, and ignited health emergencies across the planet.
As each day passes, the case numbers go up as the virus spreads through our area. And
tonight we're taking a closer look at the virus and how it's impacting our lives today and into the future. Let's begin with the latest numbers on the spread of the virus. According to data from the CDC and the World Health Organization, there are nearly 215,000 cases worldwide. More than 8,700 people have died globally. In the United States, there have been more than 7,700 cases across all 50 states and 118 deaths.
In Florida, there have been 328 cases of infection, so far 8 deaths. In Georgia, there are 197 cases. Of those, 3 are deadly.
And here's what it looks like locally when you look at all the counties. There are 14 cases in Duval County, 4 in Clay County, 3 in St. Johns, and single cases in Nassau and in Charlton County, Georgia. And again, one of those cases in Clay County was deadly.
Also important to see the latest numbers on how many people were sick but have since recovered from the virus. According to Johns Hopkins University, that amounts to more than 83,000 people. Now, this pandemic has been confusing to a lot of people. Tonight, we're going to start from the beginning because understanding the problem is the first step to overcoming it.
We'll start with explaining what a coronavirus is. It's a type of virus that's similar to the common cold, which affects a person's respiratory system. They're named for the shape of the virus, which looks similar to our sun. This strain is called COVID-19. CO stands for corona, VI stands for virus, D stands for disease, and 19 for the year that it was first identified.
The virus spreads much like influenza. The first is person-to-person contact through coughing and sneezing or handshakes. The virus hitches a ride on droplets of water. Kissing would definitely spread the virus, though it isn't clear if it's transmitted by sexual contact. The CDC recommends 6 feet of separation between you and an infected person. You can also catch it by coming into contact with an object touched by an infected person. The virus can survive on metal, glass, or plastic anywhere from 2 hours to 9 days. And as for food, the virus could hitch there as well, but heating or reheating it will kill it.
Understanding the virus and the threat that it poses is vital. Action News Jax went to UF Health to get that unparalleled expertise. They're doctors and researchers on the front lines in battles against viruses, cancers, and a host of illnesses that threaten human life. I spoke with Chad Nielsen. He is UF Health's Director of Infection Prevention and Control about what people can do right now to stay healthy and slow the spread of this virus. Sure. We greeted each other with the fist bump. Yeah. They're talking about watching that hand-to-hand contact and really focusing on washing those hands. Yeah. Let's talk about some ways that people can protect themselves, some basic stuff.
Yeah, and I think you've already hit the nail on the head with several things. You know, we know from research that actually shaking hands spreads 10 times more germs than just a fist bump, and so you'll see a lot of fist bumps and a lot of elbow bumps going on around our hospital these days. But other stuff like just basic hand hygiene, washing your hands for 20 seconds, you know, or using hand sanitizer if you can't have access to soap and water. Those are 2 really great ways. Cough etiquette, you know, so not coughing on people, not coughing on your hands, you know, cough into your arm or you know, in your shoulder. Other things like social distancing, so, you know, not sending your kids to school sick, not going to work sick, you know, distancing yourself from people who you know are sick. That's going to be an effective containment strategy to prevent COVID-19 or just regular flu or anything else.
Let's see how COVID-19 measures up to other recent viral outbreaks. In 2003, severe acute respiratory syndrome, or SARS, swept across Asia. There were more than 80,000 confirmed cases with a death toll of 774. That's a death rate of 0.96%. In 2009, the H1N1 swine flu went global. The CDC estimates that nearly 61 million people got sick. It believes that anywhere between 151,000 and 575,000 people died. That death rate, 0.05%. And what about the regular seasonal flu? There are different strains which impact people each year. During last year's flu season, the CDC estimates 35 million Americans were infected. More than 34,000 people died. That's less than 0.1%. As for the coronavirus, it's not quite clear how deadly it is. It could range anywhere from 1% to 3.5%.
And we still don't know everything about COVID-19. Scientists believe that people are contagious days in advance of having any symptoms. And let's break down what those are so you know when you need to self-quarantine. For most people, it feels like a cold. Within as soon as 2 days, patients develop a low fever, a dry cough, and experience difficulty breathing. They may also feel body aches. For patients who develop severe symptoms, their fever could jump to more than 100 degrees. They could develop pneumonia. Others could experience kidney or multi-organ failure that can cause death. Scientists are still working to figure out why some cases are worse than others. And again, you saw earlier, I spoke with Chad Nielsen with UF Health about what types of people should be the most concerned about some of these severe symptoms. Who is most at risk? Because even when we look here in Florida at our current list, a lot of folks are in their 60s and 70s. So who's most at risk?
Yeah, so it's actually variable, right? So those who are at risk for the most severe form of COVID-19 are individuals who are immunocompromised or of older age, primarily due to comorbidities and just other types of illnesses that they may have. There are some early reports that children are more protected against this than in previous types of viruses like flu, but right now it's older individuals and those with lower or weakened immune systems.
Outside of the weakened immune systems, what about people who might not be considered in the best health? Someone who might be obese or have high blood pressure, diabetes, or some other pre-existing condition?
Yeah, so some of those pre-existing conditions do have an effect on your immune system. So I think the research is yet to really prove out all of those different things, like is a hypertension patient, more at risk, or a diabetic patient. There's still a lot to be done on the research side of that, but definitely all of those types of comorbidities do lower your immune system and thus make you a little bit weaker to fight off different types of viruses.
All right, well, there is a lot of disinformation about where this strain of coronavirus came from. If you go online, there's no shortage of conspiracy theories out there. Here's one. The virus isn't a virus at all, but caused by 5G wireless networks. Yep, that's actually out there, folks. That is false and easily disproven by this thing called science. The FDA and the FCC also say there's no link between radio frequency signals and disease. All right, another myth. The virus was bioengineered in a lab by scientists to be used as a weapon or form of population control. That is false. Like crime scene detectives, scientists can genetically trace where viruses originate, and this strain comes from animals. In fact, most deadly viruses come from animals. The Black Plague, Ebola, smallpox, and more swine flu comes from pigs. SARS or avian flu came from birds as well. COVID-19 came from bats. In China, there's a $74 billion wildlife farming industry. They catch, farm, and eat an enormous variety of wild animals. Those animals are taken to so-called wet markets, stacked in cages in close proximity where viral transmission is much more likely. China is now cracking down on the industry. It's unknown what that will look like long term. Scientists with the World Health Organization say this virus, again, originated in a bat. The genetic structure of the virus shows it was then passed to a pangolin, which is a scaly anteater type animal, and then the virus was passed to a human, either by close contact or when it was consumed.
And scientists say that bats are the perfect carriers for viruses, and it has to do with their unique physiology.
It really all comes down to flight.
It's what makes bats different from any other mammal, and the ability to fly gives them the unique capacity to become infected with certain viruses while never becoming sick.
Flying takes a lot of energy. In the case of a bat, so much so that it kind of breaks the cells apart.
In other words, flying damages some of the bat's own cells. Normally, cell damage in a mammal triggers an immune response that leads to inflammation. And so it's believed that bats naturally have slightly weaker immune systems. On the plus side, that keeps them from suffering constant inflammation. On the downside, at least from a human perspective, when bats get infected with the coronavirus,
They don't kill the virus, they just keep the virus in check.
and thus they carry infection. They could pass that on to humans directly or to another animal that people come into contact with. Coming up on our in-depth look at the coronavirus, leaders take action.
We take a hard look at what's being done to protect public safety and save lives. Throughout this program, we'll separate fact from fiction. Here's one. Packages shipped from China could be infected. That is fiction. The virus cannot survive long-term on objects like letters or packages.
We now return to Action News Jack's special coverage, Coronavirus Pandemic.
Well, for the immediate future, American life as we know it has been put on pause.
In the span of 2 weeks, we've seen businesses, government operations, school systems all shut down.
Yeah, just yesterday we learned that all public school districts in Florida will remain shut down through April 15th.
The goal with all of this is, of course, to stop the spread of the virus. Experts call it flattening the curve. Let's detail what that means. Take a look at this diagram. You can see two curves. Both show what could happen when the virus reaches its peak when it comes to infection. The first curve shows what happens if people do not take action. Now, if people continue to mingle in crowds and spread the virus, the healthcare industry will not be able to care for all of the people who are sick. The second curve shows what would happen if people make smart decisions. Stay home if they feel sick. Cases of infection would spike, but at a manageable level for our healthcare industry.
Right now, federal, state, and local governments are working to quickly expand coronavirus testing. Knowing who is infected, that's a vital part of preventing the spread. However, you do not need to get tested to start making smart choices. Here's what you should do. If you're experiencing symptoms like fever, cough, or difficulty breathing, the first thing you should do is quarantine yourself from the public and your family members. Do not go to the hospital because that puts other people, including healthcare workers, at risk of getting infected. Instead, call your healthcare provider and that person will decide if you should be tested. Now, if you're a healthy person, your symptoms aren't that severe, you may just have to isolate. They may tell you to just take some over-the-counter medicines and rest up. If you're older and have underlying health conditions, your healthcare provider may decide that you need to be tested. They'll work with the health department to schedule when and where you get tested. The only other reasons you may need to get tested is if you were exposed to someone who has tested positive, if you work in the healthcare industry, or if you travel to an infected area. Whatever the case, you can't just show up at this point. A doctor will have to decide if a test is necessary and then let you know the next steps. Jacksonville Mayor Lenny Curry is promising to have new drive-through testing sites up and running by the end of this week and more early next week. Action News Jack's Bridget Matter shows us one of those testing sites. Let's give you a look at what we're seeing here today. There are several tents counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, about 10 tents here. Most of these test sites will be drive-up test sites where you will be swabbed in your vehicle. Action News Jack's Sky Vision drone flew over TIAA Bank Field just to give you another vantage point of this. We watched yesterday as they started putting this site up. The mayor said testing could begin as soon as this week. His goal is to test more than 1,000 people per day by the end of the week. The city says 2 testing sites will be operating in the city of Jacksonville. The city is working on making its drive-through test site free. St. Vincent started drive-through testing of pre-screened patients Tuesday. Now Mayo Clinic is working on drive-through testing as well. We do know that the city-run site is by appointment only. That will be made through an app or online. You cannot just drive up and get tested. We're waiting to get information on both sites. We should have that by the end of the week. In downtown, Bridget Matter, Fox 30 Action News Jax.
In a few days, all Duval County Public Schools will resume class Monday, but they will be working online. As Action News Jack's Elizabeth Pace reports, students who don't have a computer or internet at home are asked to call their individual school.
2 local county school districts are really at the forefront of this home-based education. Duval and Union counties. Come Monday, all of their students will continue learning, but it's all going to be online.
It's very daunting.
Phyllis Edwards watches her 7 grandchildren during the day while their parents are at work. Now she'll also be in charge of making sure they complete all of their schoolwork online.
I will have to learn how to separate the times, get everybody focused, stay away from the area where there will be a center set up for them to do their work online.
Due to coronavirus concerns, the Duval County Public School District will start home-based learning on Monday, March 23rd. Most parents and students are already familiar with iReady and Achieve 3000 online. The district says those programs will be part of their new system, and students will pick up right where they left off about 2 weeks ago. Each student will log into what they call Duval Homeroom. Grades 6 through 12 will be all online. But they say it's a little bit more tricky to do online learning with their elementary school students. So they're working with their bus services to drop off supplemental packets and free lunches to those students each day. Anyone who doesn't have a laptop or internet services at home, the district is asking you to call them so they can provide it for you. Comcast is giving away free internet to students for 2 months. The district will start dropping off laptops this weekend. Again, if you don't have those resources at home, the district is asking you to call your school or that district hotline. They plan to continue this home-based education until at least April 15th. They say they will continue to watch for updates on the situation. Reporting on the South Bank, Elizabeth Pace, CBS 47 Fox 30, Action News Jax.
All right, so Duval parents, take down the number you see on your screen. This is that district hotline Elizabeth was just talking about. Obviously, if you are online and able to go to actionnewsjax.com, you can go and get the survey. But if you don't have access to that, the number to call, 904-348-5200. Let them know what your capabilities are. If you don't have the equipment needed, they can get it to you as early as this weekend and get you up and running for next week.
Experts say an injection of money back into businesses and people could help the economy get out of a free fall. Other than the toll this disease is having on the thousands of people who've lost family members, nothing has taken a harder hit than global economics. Take a look at data showing how well the Dow Jones Industrial Average closed each day beginning last month. And you can see that it dropped off a cliff in mid-February, erasing all the gains from last year. Now, repeatedly, we've seen the market break its own record for the most points lost in a day. We've seen some gains as well, but overall, the trend is down, and today was no exception. The Dow lost more than 1,000 points. It closed under 2,000. The NASDAQ and S&P also dropped by triple digits.
Right now, lawmakers at federal, state, and local levels are working to lessen the financial impact on Americans. Many people can't go to work because businesses are closed. Others have to stay home to provide child care because schools are closed. Here's a look at some of the things being worked on right now to help. Congress is working on several bipartisan economic stimulus packages that could top $1 trillion. One bill passed today that provides 2 weeks of paid leave for some Americans who don't have those benefits. It also contains money for small business loans. Other bills still being worked on would include bailouts for the travel industry, and the federal government also working on sending money directly to Americans. The exact amount of that still being worked out, and whether it will happen still being worked out. Could be $1,000 or so. Coming up on our in-depth look at coronavirus, taking the fight to the virus.
We delve into the steps you can take to protect yourself and your community.
We now return to Action News Jax special coverage, Coronavirus Pandemic.
All right. One thing to take away from all of this, if there's only just one thing, it can't be understated when it comes to prevention.
Yeah, we're talking about washing your hands. And it's just really amazing how little soap and water can destroy viruses. We've seen the hand sanitizer selling out, but it's nothing like soap and water. So here's a science lesson. Viruses are made of proteins, which have an oily coating, which help it sticks to your skin. Now, if you rinse your hands with water, it won't wash away viruses. They are hydrophobic. They repel water. But when you add that soap and lather up, it creates an emulsion that not only bonds to viruses, but it literally rips them apart. You need to lather up for at least 20 seconds to make this reaction happen. And then when you rinse your hands, it all goes down the drain. There's a really cool video going around with the pepper demonstration that kind of shows how that works.
That's right. So here's the best part of all this. Any kind of soap has this effect. Dish soap, hand soap, bar soap, scented soap, it all works the same.
So yeah, again, if you can't find that hand sanitizer in the store, the CDC actually says soap is more effective anyway.
Yeah.
I'm going to repeat that. Soap is more effective than hand sanitizer, according to the experts at the CDC.
Now, sanitizer's better than nothing, but
Yes.
soap is the best. All right, coming up, coping with the coronavirus, how you can deal with the stress, the anxiety, uncertainty.
And let's keep debunking coronavirus myths. There's a vaccine that already exists in the works that's floating around, but that is false. Scientists just started testing a vaccine this week. The first woman got it in Washington State. It will be roughly 18 months before it's determined whether or not it's safe enough to give to the public.
We now return to Action News Jack's special coverage, Coronavirus Pandemic.
Yeah, for some, anxiety is spreading right along with the coronavirus.
And knowing how to cope with that is just as important as washing your hands. Experts at UF Health gave us some great advice. The number one is to unplug. Even for us news folks, it's important for us to stay updated, but you don't have to constantly be tuned in to what's happening. So take those breaks. Also, number two, fight back against cabin fever. If you're not sick, there are plenty of things you can do outdoors that are not around other people. And that goes hand in hand with number three, exercise. Working out is a great stress reliever. And that's not all. You can get more mental health resources at actionnewsjax.com.
Well, count on Action News Jax to work to bring you the latest information on this pandemic.
We'll bring that to you on air, on our mobile app, and scrolling at the bottom of your screen.
Thank you for joining us tonight. Stay healthy. Remember to make good choices and wash those hands.
This has been Action News Jack's special coverage, Coronavirus Pandemic.